Hi, it's Eleanor Hayes from Birthsang here, and today I want to talk a little bit about the position that you adopt during sleep or rest in pregnancy. Many women are advised in the third trimester, so that's around 26, 27, 28 weeks of pregnancy, to start avoiding lying on their back when they're in bed, when they're resting or asleep. And the reason is because there are some really major arteries that come down in front of your spine, but are behind your organs. And they come down your spine and then they split and branch out in your pelvis and disseminate blood around the body. When you're in the late stages of pregnancy, your baby and the amniotic fluid and the uterus and all of your bump basically becomes much bigger and much heavier. And when you lie on your back, what can happen is the blood vessels can be constricted and compressed by the weight of your baby and your uterus. And so this means that there's not the perfect amount of blood flowing around your body. And ultimately what that means is that you're not getting all of the blood that you need, but also that blood is not being delivered to your uterus, and therefore it's not getting to your placenta and ultimately to your baby. So we want to avoid that as much as possible. And what we often find is that if you do lie on your back, in the later parts of pregnancy, it can often make you start feeling a little bit dizzy or a little bit woozy. And that's your body's way of kind of encouraging you to change position. Sometimes you find that you wake up in the night and you're lying on your back and you just think, oh no, I'm lying on my back, it's terrible. And actually the best thing to do is not to stress too much about it. Probably the reason you've woken up is because your body has recognised that there's a little bit of restriction of blood flow and it's actually woken you up to make you move position. So it's best not to stress about it. Another thing that is often advised in addition to this is to try to sleep on your left-hand side rather than your right-hand side. And the reasons for this are slightly different, and it's to do with the position of your baby. So let's just have a look to see what that's all about. So after about 30 weeks of pregnancy, your baby is going to turn so it's facing head down. And so ideally at the beginning of labour, we want your baby to be facing head down in your pelvis and facing towards your right hand side, okay, because your baby is going to turn in a clockwise direction in labour and birth. So when it starts in labour in this position, then we know that it's going to be the most optimal version of the delivery. What we find when we lie down on our left-hand side, if you can imagine, is that whatever position your baby is in inside of your uterus, the heaviest part of it, basically its back and its head, tends to then be pulled by gravity down towards the floor. And so it creates this way of encouraging and almost forcing the baby to adopt this position. And so when you're lying on your left-hand side very frequently, what happens is the baby is pushed into that position by gravity and it's encouraged to get into that optimal position again and again and again. And as the baby gets bigger and the space inside of your uterus gets smaller, the baby is finding it happy. It likes being in that position because it's really used to being in that position, and it just encourages the baby to perhaps make sure they're in that position by the time your labour starts. Now, it's not guaranteed, and there aren't really, there's not a great deal of research around this. It's quite anecdotal, but it makes sense that if your baby is in a certain position throughout your pregnancy and it's feeling really comfortable there, then when labour begins and the contractions start compressing it and the baby's kind of maybe thinking, what's going on? It's maybe slightly stressful. It's likely to adopt a position that it feels most comfortable in. So it's a way of encouraging a baby to get in the right position. There's no guarantees, of course, in this life about what position your baby will be in. So again, I wouldn't stress if you absolutely hate lying on your side, in your left-hand side. If you absolutely can't get comfortable on your left-hand side, don't sweat it. Don't worry about it. Lie on your right-hand side, whatever. If you find it really uncomfortable in any position except lying on your back, don't worry about it too much. What you can do is you can try to prop yourself up on one side underneath your back. So you're slightly tilted, so you're not quite flat on your bed, but one side is slightly higher than the other. And that can just release any compression and perhaps help to make you feel a bit less worried about being in the position. But having good sleep in pregnancy is hard enough without adding additional stress and worry about what position you're in. So what I encourage people to do is early on in your pregnancy, try to get into the habit and try and get used to sleeping on your left-hand side and resting on your left-hand side. And just try, if you do wake up, try starting on your left and try to get into a place where you feel comfortable on your left and you've got used to it well before the point you've got a big bump and actually you're finding it hard to sleep anyway. Because if you suddenly switch over at 26 weeks or 28 weeks, you may well find it's quite difficult to kind of find a comfortable place. So the earlier we can do that in pregnancy, the more likely we're going to be able to find it comfortable later on. And so I think it's important not to stress. Sleep is always more important than anything else. And if there's really going to be cause for concern, your body will tell you. It will make you feel dizzy, it will wake you up, and it will encourage you to get into a different position. So I hope that helps you feel a bit more reassured about why you're being asked to avoid lying on your back and perhaps to try lying on your left-hand side. But actually, it's not going to make a huge amount of difference in the grand scheme of things if it's making you lose sleep. One final thing I will just mention before I sign off, and that's just about resting and hanging around on the sofa, lounging around during the day. Now, you're not going to be lying flat on your back, probably. Again, the compression is absolutely relevant. So if you can be on your side, that's helpful. But also what we do know is if you're lounging back like this on a sofa, a lot of the time later on in your pregnancy, it can discourage your baby from turning head down after 30 weeks. So it's quite a good idea to, again, get out of the habit of lounging back on the sofa just until you know, around between 28 and maybe 35, 36 weeks when you know your baby has turned head down. Because while breech is another version of a normal labour, there are different risks attached to it, and most people find that they want to have as easy and straightforward a birth as possible, and for that we want the baby to be in a head down position and facing towards your right hand side. So thanks for listening. Please feel free to subscribe to my YouTube channel to be notified about other videos that I'm going to be posting about little aspects of labour and birth, and hope to see you soon. Bye.